It can happen during sex, at the gym, during yoga, sometimes even just standing up. A sudden sound, almost identical to a fart. But it didn't come from the intestines, it came from the vagina. And despite how embarrassing it can feel, queefing is a completely normal biomechanical event. The clinical term is vaginal flatus, and to be clear from the start, it has nothing to do with digestion. No gas is produced, and bacteria aren't involved. It's simply ordinary air entering the vaginal canal and then being expelled. And despite common myths, it's not because the vagina is too big or too loose. To understand why it happens, you need to understand how dynamic the vagina really is. The vaginal canal is flexible muscular tissue lined with folds called rugae, which allow it to expand and contract dramatically. In its resting state, it measures roughly 7 to 12 centimeters, extending from the vaginal opening to the cervix. Unlike the intestines, the vagina produces no gas and has no one-way valve. It's a potential space, meaning its walls normally rest against each other, but the canal opens with pressure, movement, arousal, or penetration. Surrounding the canal are the pelvic floor muscles, which regulate its tone and diameter. When relaxed, the canal opens more easily. When contracted, it narrows and seals. The vaginal opening, the introitus, connects directly to the outside environment. There are several well-documented ways this happens. During penetrative sex, the inserting object acts like a piston in a cylinder. Each outward stroke creates a partial vacuum behind it, drawing air inward. Repeated movement can progressively trap more air deeper in the canal. Sexual arousal also plays a role. During arousal, the vagina undergoes a process called vaginal tenting. The inner two-thirds of the canal elongate and widen, creating significantly more space. This makes it easier for air to enter and become trapped. Certain body positions are another factor, particularly ones that tilt the pelvis, like deep squats, downward dog, or lying with legs raised. When the body returns to an upright position, increased abdominal pressure pushes that trapped air back out. Normally, the pelvic floor muscles keep the introitus gently closed at rest. But when these muscles lose tone, due to childbirth, pregnancy, hormonal changes, aging, or nerve injury, air enters more easily during everyday movement. That's why many women notice more queefing after vaginal delivery or during postpartum recovery. Pelvic floor physical therapy can help rebuild that tone. Many women also notice more queefing during their period, due to uterine contractions, abdominal bloating, and the mechanical effect of menstrual product use. Air can also enter during pelvic examinations, or any movement that creates a sudden pressure change inside the canal. Once air is inside the vaginal canal, it will eventually come out. And what happens next is simple physics. As air rushes out through the vaginal opening, it passes the soft tissue folds at the introitus, the labia minora. Those tissues vibrate as the air moves past them, generating that characteristic sound. The pitch and volume depend on the volume of air that was trapped, the speed of expulsion, and the tone of the surrounding musculature. Unlike the anal sphincter, which provides fine-tuned voluntary control over intestinal gas, the introitus has no dedicated sphincter muscle. The pelvic floor provides general tone, but there is no mechanism designed to selectively hold air inside the vaginal canal. This is why queefing frequently can't be anticipated or suppressed. It isn't a failure of control. It's simply how the anatomy is built. For most women, vaginal flatus is completely harmless. But persistent air release can sometimes point to an underlying condition. One important example is a rectovaginal fistula, an abnormal connection between the rectum and the vaginal wall. In this case, actual intestinal gas, and sometimes fecal matter, can pass into the vaginal canal. This can develop after complicated childbirth, pelvic surgery, radiation therapy, or conditions like Crohn's disease. Frequent queefing can also accompany significant pelvic floor dysfunction. When the pelvic floor is considerably weakened, air enters more easily during everyday movement. If it's paired with urine leakage or a sensation of pelvic pressure, it may sometimes be associated with pelvic organ prolapse. Some women also notice increased vaginal flatus after hysterectomy due to changes in pelvic anatomy and vaginal vault support. The key distinction is straightforward. Odorless air during sex, exercise, or movement is almost always normal. If the air has an intestinal odor or there is any fecal discharge, that warrants a visit to a physician. Vaginal flatus is well documented in gynecological research and pelvic floor medicine. Yet most women never receive a real explanation for it. For the vast majority, a queef is simply anatomy and physics at work. It's not a disease, not a sign of looseness, and not a sign that anything is wrong. The gap between how common this is and how rarely it's explained is its own kind of problem. Because shame around a normal physiological event can stop women from mentioning symptoms that actually do need attention.